Hi, I'm Toby Kohler. I'm a urologist here at SAU School of Medicine. I'm an associate professor in the Division of Urology. I deal with men's health, sexual function, and fertility problems. I'm the director of our Oncofertillity program, and that's a fancy way for saying take care of patients' fertility or their ability to have kids in the context of having cancer. You know, both my parents had cancer. My mom had breast cancer. My father had prostate cancer. There's many medical problems in my family, so that of course gives me more empathy and understanding of what patients are going through, having gone through it myself. Cancer will affect most people in their lives, and so at one point in your life or another, either yourself or your loved one or your daughter or father or brother or sister are going to be affected with cancer. And when that happens, everybody tends to focus on the cancer diagnosis. But when we have young patients, patients in their years where they can still have kids, everybody focuses on their cancer, but it's our job to focus on the other things that they can't think about because they're kind of have tunnel vision for, am I going to die? What's my treatment going to be like? That kind of thing. So that's where oncofertility comes in. And again, we want to think about preserving fertility in both men and women. And the best way to do that is address these questions before we actually initiate cancer treatment, right? So once we do chemotherapy or once we do radiation or surgery to address cancer, often we produce sometimes irreversible changes in men and women's ability to have kids. And at the end of the day, especially in young people, about 80% of young people with cancer end up doing well and living a long life thereafter. So a few years after their cancer diagnosis, what's most important to them? Well, it's raising a family and having kids, right? And so if you don't think about it as you're going through the process, it's often too late. So again, it's our job to think about these things, and there are so many things we can do as long as we remember to do them. It's very simple. You just need to get in touch with either me or anybody else in the oncofertility group, and we'll take care of both men and women and address these concerns so that later down the road you can have your own genetic children and live a long, happy, healthy life with family.